Our next speaker is Professor Ann Gore. She is a clinical associate professor and head of the Pediatric Allergy Service and senior consultant of respiratory medicine, Department of Pediatrics, KK Women's and Children's Hospital, Singapore. A well-published academic, she's actively involved in research areas such as bronchial asthma and allergy. She will be speaking with us today on developing gut health and immunity in early life. A very warm welcome to Professor Gore.
I'd like to thank FrieslandCampina for inviting me to give this talk. The topic of the talk is developing gut health and immunity in early life. What then is gut health? When we think of a healthy gut, we probably think of an effective digestion and absorption of food, nutrients, as that is the main function when one thinks of the gut. Also, the absence of gastrointestinal symptoms and disease. Less often does one think of the gut in terms of its immune function and the microbiome, even though it is the organ with the highest number of bacteria and the first encounter with microbes soon after birth. The interaction with colonizing microbes is essential for healthy immune maturation and the development of tolerance. Innate immune receptors, such as toll-like receptors, are key mediators between the host and the colonizing microbes that lead to tolerance. The epithelial lining of the gut, along with the protective layer of mucus lining the intestinal lumen, is referred to the gastrointestinal barrier. The gastrointestinal barrier provides defense via a dynamic immune system and enables communication between the gut microbiota and the brain, referred to as the gut-brain axis. Disruption of the gut microbiota leads to dysbiosis and disease. The initial colonization of the infant gut is largely a result of the exposure to microbes from the maternal vagina and fecal microbiota acquired during delivery. Maternal skin and breast milk microbiota are acquired during breastfeeding. Hence, in early life, the infant gut microbiota is heavily influenced by maternal health, the mode of delivery, and subsequent feeding. In terms of the mode of delivery, as you can see here, infants delivered vaginally have gut microbiota with high levels of lactobacillus and Prevotella, while those delivered by C-section or cesarean section have increased Staphylococcus aureus bacterium and Propionibacterium bacterium. In terms of feeding, children who are breastfed have high levels of Bifidobacterium, while those on formula feeding have increased Bacteroidetes and Clostridium species. When weaning occurs, higher levels of Firmicutes species occur, and children who receive antibiotics again have disruption of their gut microbiota, leading to an increased Enterococcus and decrease in the Bifidobacterium species. The colonization of the gut microbiota occurs very soon after birth, and in infants who are delivered by vaginal delivery and who are breastfed from birth, there is a rapid increase in Bifidobacterium in the gut with a reduction of other anaerobes, especially facultative anaerobes. Why this predominance in Bifidobacteria? Bifidobacteria is the predominant bacteria that is found in the newborn gut and makes up 60 to 70% of the microbes which are colonizing the gut. The predominance decreases with age, as you can see in this picture, and especially after weaning, where greater bacterial diversity occurs. This predominance of the bifidobacteria is seen especially in infants who are exclusively breastfed. And why is this so? And first, let us therefore look at what is found in breast milk. Many bioactive components are found in breast milk, of which human milk oligosaccharides are abundant, making up about the third most abundant ingredient that is found in breast milk outside of water. Of the human milk oligosaccharides, the 2-fucosyl lactose, or 2FL, is the most common. When one looks at the bifidobacterial species that is found in the human or infant gut, Bifidobacteria longum, Bifidobacteria bifidum, and brevi are the predominant bifidobacterial species that are seen, as can be seen in this picture. And why these species? The consumption of human milk oligosaccharides is found to be highly specific, and 2FL is utilized mainly by the bifidobacteria species, and in particular, Bifidobacteria longum, brevi, and bifidum. Hence, with the increased amount of bifidobacterium found in the infant gut, 2FL is the main human milk oligosaccharide that is being utilized by these species. Human milk oligosaccharides strengthen the gut barrier function by binding to cell surfaces and regulates the release of protective factors and prevents pathogen adhesion by binding to pathogens or by acting as decoys, and thus preventing adherence to cell receptors on the surface of the epithelial cells. Human milk oligosaccharides function as a prebiotic as well in the gut and promotes the growth of beneficial bacteria such as bifidobacteria. This also increases the production of short-chain fatty acids, which support the development of the gut mucosal barrier, and by decreasing the gut pH, reduce the production of unfavorable bacteria. The bifidobacteria also support the immune responses by stimulating the lymphocytes to produce IgA antibodies as well as the synthesis of vitamins. Thus, maternal health and the nutritional status influence breast milk microbiota, and the breast milk components in turn shape the infant gut microbiota, especially in relation to immune factors and the human milk oligosaccharides as well as the microbial composition. Breastfeeding in many studies have been shown to reduce diarrheal as well as respiratory tract infections. And therefore, there must be components in breast milk which are doing this. And what has been shown is that infants who are fed with breast milk which are rich in 2FL have a lower risk of acute respiratory infections. This shows that human milk oligosaccharides play a major role in immune function. What I've shown you in these previous few slides, therefore, is that there are multiple factors that affect the development of the infant gut microbiota, such as the mother's health, the mode of delivery, the duration of gestation, the mode of feeding, and the use of antibiotics and external environmental factors all have an impact on the development of the infant gut microbiota. A healthy gut microbiota leads to health, while disruption of the microbiota leads to a dysbiosis and the development of allergic disease, gastrointestinal disease such as inflammatory bowel disease, and metabolic diseases such as obesity and diabetes. Since many factors affect the gut microbiota, are there strategies that we can use to modulate the gut microbiome towards the healthy microbiome when disruption or dysbiosis occurs? Let's look first at human milk oligosaccharides. Several HMOs have been developed, such as 2FL and LNNT, which is lacto-N-no-tetroids. And this study that is done in adults showed that supplementation with the HMO 2FL and NNT led to an increase in actinobacteria, which is namely bifidobacteria. It was well tolerated and could therefore be used to modulate the gut microbiota and restore homeostasis in those with an unbalanced microbiota. In a study in infants who were fed a formula with HMO had a gut microbiome closer to that of breastfed infants, with much higher levels of bifidobacteria compared to control formula, as can be seen in the chart. Hence, supplementation with HMO in formulas can lead a dysbiotic gut towards a more healthy microbiome. These infants who were fed formula containing the HMO also had fewer respiratory tract infections compared to the standard cow's milk formula. And again, this shows, therefore, that supplementation with HMO improves immune function. And similarly, in another study where infants fed a formula containing 2 HMOs, this time 2FL and LN&T, were shown to have less bronchitis, lower respiratory tract infection, and the need for antibiotics. What about pro, pre, and symbiotics? Probiotics are live organisms used to control the growth of pathogenic bacteria in the gut by increasing the beneficial bacteria and restoring the metabolic activity. Whereas prebiotics are complex carbohydrates which provide nutrition for the growth of beneficial bacteria in the gut, such as bifidobacteriaceae and lactobacilliaceae, which increases the production of short-chain fatty acids that decrease luminal pH, which in turn decreases the growth of pathogenic bacteria. And symbiotics are simply a combination of both the pre and the probiotics. Let's look then at probiotics. This study looked at the role of Lactobacillus GG used in formula on infants with cow's milk allergic proctocolitis. And it showed that infants fed with the supplemented Lactobacillus GG had faster resolution of symptoms compared to the control group after 4 weeks. Whereas with complete resolution of blood in the stools compared to 64% in the control group. Infants with cow's milk allergy who received an extensively hydrolyzed formula with Lactobacillus GG, in this case it was Nutramigen, had acquisition of tolerance to cow's milk faster than the control formula without Lactobacillus GG in both the IgE and the non-IgE mediated forms of cow's milk allergy. Lactobacillus rhamnosus GG as a probiotic has been shown to downregulate intestinal inflammation by decreasing the tumor necrosis factor in the gut. It also expands butyrate-producing bacteria, which increases the production of short-chain fatty acids in the gut. And we have already shown that with the production of short-chain fatty acids in the gut, there's reduction of pathogenic bacteria and improvement in gut health. So this may be one way that the probiotics are working to induce faster tolerance to some of these infants with milk allergy. What about prebiotics? In this study of infants born to atopic parents, feeding a formula supplemented with prebiotics, in this instance galacto-oligosaccharide GOS and fructo-oligosaccharide FOS, in combination showed reduction in eczema, again through increasing bifidobacteria in the gut through the production of butyrate. In this study that was conducted in the prebiotics in the prevention of atopy study called the PIPA study, conducted in Italy, was a 2-year randomized double-blind placebo-controlled trial evaluating the effects of a combination of GOS polydextrose formula, again on infants who looked at the outcome of eczema in infections. These infants were high-risk infants who are born to atopic parents. And what they showed here was that at 1 year old, infants on the study formula had fewer respiratory infections, but this effect was lost after stopping the formula after the first year. However, when they compared the number of episodes of recurrent respiratory infections and wheezy lower respiratory tract infections, these infants on the prebiotic enriched formula had fewer episodes, which was similar to that of the breastfed infants as compared to those who were fed the standard formula. What about symbiotics? In this study, looking at infants born vaginally as compared to those born by cesarean section, infants with delivered vaginally had earlier colonization with bifidobacteria, while those with cesarean section had delayed colonization of bifidobacteria. In this study, therefore, they looked at infants who were delivered by cesarean section and randomized them to receive a formula containing symbiotics, prebiotics, or a standard formula. And what this study showed was that the symbiotic supplemented formula restored the growth of bifidobacterium very similar to that of the vaginally delivered delivered infants, such that there was early colonization of the bifidobacteria much earlier than those who were fed with the control formula or the prebiotic supplemented formula. In this study too, they demonstrated that the symbiotic supplemented group had lower incidence of atopic dermatitis, such as eczema. Let's look at vitamin D. Vitamin D enhances cellular innate immunity through induction of antimicrobial peptides, and it also modulates the adaptive immunity. Vitamin D helps to maintain the integrity of tight junctions as well as gap junctions, and that improves the epithelial cell barrier. Vitamin D also enhances the expression of genes related to antioxidants, which may have antimicrobial activities. This meta-analysis shows that vitamin D supplementation led to reduction in acute respiratory tract infections. And this benefit was greater in those with lower levels of 25-hydroxy-D levels, and essentially those with either vitamin D insufficiency or deficiency. You had a greater benefit with vitamin D supplementation. Another study also looked at children with eczema, and what was found that children with severe eczema were also more likely to be vitamin D deficient. This could be explained by the fact that there may be genetic polymorphisms of vitamin D receptors on skin keratocytes, increasing the risk of eczema. Also, the expression of synthesis of filaggrin is regulated by vitamin D, and therefore vitamin D deficiency can increase the risk of developing eczema. This meta-analysis supports this finding in that individuals with eczema had lower levels of 25-hydroxy-D compared to healthy controls. Hence, supplementation with vitamin D led to improvement in atopic dermatitis. And the mean dose of vitamin D that was supplemented was 1,500 international units per day. So what I've shown you, therefore, is that in particular in children or individuals with vitamin D deficiency, supplementation with vitamin D will improve the disease condition as well. So some key take-home messages. The gut microbiota plays an important role in immune development and health. And dysbiosis, I've shown you, has long-term health consequences, leading to allergic, autoimmune, and metabolic disease. Breastfeeding, vaginal delivery, and reduced use of antibiotics have beneficial effects on the gut microbiome. And some strategies that we could use to modulate the dysbiosis includes the use of supplementation with HMO, pro, pre, and symbiotics to restore the microbiome of a dysbiotic gut, and vitamin D, especially in the presence of vitamin D insufficiency and deficiency. Thank you.
We'd like to thank Professor Angor for the brilliant lecture and the deep insights that we have gained into gut health and immunity in early life. I will look forward to having her at the question and answer session. The FrieslandCampina Institute team will provide relevant instructions on how to drop your questions in the chat box, and we will take it up from there.